Hello, you're welcome back to Love Your Health YouTube channel. It's been a while. I've missed all of you. I'm sorry for that, my followers. This is Love Your Health YouTube channel. This is your preventive nurse once again on your screen. We started with the topic diabetes mellitus, which is a chronic disease which is claiming so many lives globally. It's really a canker that we have to discuss and try as much as possible to prevent ourselves from that. It's very important. Okay, in the part one, we did the part one already, and in the part one, we discussed the global picture when it comes to diabetes mellitus, and we also talk about the risk factors in general when it comes to diabetes mellitus. But in today's video, we are going to discuss the types of diabetes. Okay, so we are going to look at the types of diabetes, and we have three types of diabetes. We have diabetes type 1, diabetes type 2, and gestational diabetes or pregnancy-induced diabetes. Okay, so let's look at the type 1 diabetes. In the type 1 diabetes, the research shows that it's an autoimmune disease. When it says a disease is an autoimmune, meaning that your healthy cells in your body is fighting each other. In that process, it causes a disease because under normal circumstances, your healthy cells should be protecting you from other unhealthy, external unhealthy things that enters your body or antigens that enters your body. By an autoimmune diseases, the healthy cells rather fights itself in your system. So relating to the type diabetes mellitus, meaning that the pancreas, the cells in the pancreas, the beta cells in the pancreas fight each other. In this case, there is a deficiency in the production of insulin, hence diabetes type 1. Okay, and research shows that about the number of people having diabetes globally, about 10% are living with the type 1 diabetes. Okay, that makes its cause unknown because it's an autoimmune condition. So let's look at the type 2 diabetes. The type 2 diabetes is normally called non-insulin dependent diabetes formally, okay, because most of the times we look at it as a lifestyle disease. So when it happens like that, with diet and a few exercise and other things, you can be brought back to normalcy, or you can move back to normal glucose level. Okay, so with the type 2 diabetes, we said that you have to really, things that can let you get the diabetes type 2 is in physical inactivity. If you are somebody who doesn't do exercise, you are not active, you can get a diabetes type 2. And if you are somebody who takes a lot of saturated fat, it puts you at a higher risk of developing type 2 diabetes. And somebody who also is obese, when you say somebody is obese, that means the person's body mass index is above 29.9. Okay, then we say the person is obese or overweight. So you have to attain a healthy weight and also maintain a healthy weight. So the fact that you are obese, it puts you at risk of developing type 2 diabetes. And also the fact that you are in a family that have members have diabetes, it also puts you at risk of developing that. So because your lifestyle is the same, you eat the same kind of food, you live the same lifestyle, so it also puts you at risk. But that doesn't mean that if somebody have it in your family, by all means you should have it. You can help yourself, but avoiding the risk that much. Okay, so that's about the type 2 diabetes. So let's also look at the type 3, which is the gestational diabetes. Okay, this type of diabetes is so funny that it comes as a result of pregnancy. You don't have diabetes, but as a result of pregnancy, you develop diabetes. And this one, if it's well managed during pregnancy, after delivery, it goes off. And even if it doesn't go off after that, you have to actually work on your diet. You have to actually work on your diet and also do exercise a lot and your medications, and it can go. And people remain diabetic after the gestational diabetes, after they got it during pregnancy. People, it's keep on moving on until they live with diabetes and they become diabetes patient. Okay, so it's very important that when you get the gestational diabetes, it's well managed during pregnancy. And also, one thing you have to know is that there is some disease conditions that also put you at risk of getting this diabetes type 2. Example like the hypertension can also put you at risk. High cholesterol can put you at risk of developing diabetes mellitus. Okay, and if you also have any condition, any viral condition that you are on medication, example COVID-19, HIV and AIDS, or any other viral infection that you are on medication, can also put you at risk of developing diabetes mellitus. Somebody will say that, oh, for me, I don't eat sugar, so I'm not at risk of getting diabetes mellitus. Okay, but that is not the case. You have to know that everything that you take into your system, everything that you eat in form of carbohydrate, the end product is starch. The end product is glucose. So you are also at risk of. But what you want to say is that eating everything in moderation is very important when it comes to prevention of diabetes mellitus, or staying far away from diabetes mellitus.